And you're good with the little F-bomb here and there.
Oh, good with a lot of F-bomb.
Okay, I just want to make sure. It's like, it's my natural state right now.
Yeah, well, we're live, so people heard you're
Yeah.
asking permission. But I
Oh,
mean, you're an ER doctor. You're supposed to be cool, calm, and collected. But I feel like you are always on the razor's edge, and I feel like that's because you see all of the problems. You can also see the problems coming down the pike. Welcome back, Rob.
thanks. Good to be here.
When I say that, one of the things coming is COVID. It's not going anywhere. Neither is the flu, neither are measles, and now the worm has completely eaten our Health and Human Services Secretary's brain. And there's news now because the FDA is now limiting access to COVID-19. What does that mean?
Yeah, it just means it's going to be harder for regular folks to go in to their pharmacy and get a shot, right? And protect themselves, protect their families, protect their communities. They're limiting it to people over 65, people with some risk factor. They're specifically, the CDC recommended now against pregnant women getting it, and American College of Obstetricians and Gynecologists, the leading healthcare voice for OBGYNs, came out and directly contradicted that, because we have all seen pregnant women get extremely sick from COVID, get blood clots because they get COVID and they're pregnant. They have seen it. I've seen it. We've all seen it. It's freaking crazy. And yeah, I think it's just really sad that they're letting politics take over, like real data, real science, and real lived experience of docs and patients. We know what happened, and this winter could be rough.
Well, I'm healthy. I don't need to worry about vaccines. So why should I care?
Yeah, I mean, we're all healthy until we're not, right? And so I have seen plenty of previously very healthy young folks get really, really sick from COVID, but then have lasting effects of being so sick from COVID, long COVID, or even if it isn't like years, I mean, months of being short of breath and fatigue and not being able to do normal things. There's a thing called POTS, postural orthostatic tachycardia. It just means people's heart rates go crazy fast when they stand up. We're seeing a huge surge of that in people who have had COVID, and it's for some people becoming debilitating. They can't do normal, functional daily life kind of activities. So that's one thing, and the other thing is just all of us who are youngish, I'm youngish and healthy, still interact with people in our lives that are older, people who are immunocompromised, pregnant women, people who would benefit from us maybe not getting them sick. And so, just as a service to our fellow human, seems like a good idea maybe not to be spreading this thing around.
Yeah. I mean, I only care about the people I know.
Well, just hang out with them and you still want to protect them, right?
Well, they sometimes hang out with people they don't know, which is I've tried to make them stop, but they keep doing it.
Yeah.
I mean, I say these things as a way to demonstrate the fact that there is that attitude out there. And I think just, what do we do about, cultural self-interest in this case, in this country, when it comes to illness? I point to COVID as a real illustration of who we are, and that we Americans haven't made a shared sacrifice in our lifetimes. There has been no shared sacrifice, but that's what society sometimes needs and calls for. I think it's fair to say. I'll shut up and go back to the
Yeah.
expert.
Yeah. Well, I mean, my grandparents made a shared sacrifice in World War II. My great uncles went and served over there and had lifelong health problems related to, shrapnel and PTSD. And, I mean, people rationed right during World War II. I mean, so there was a shared sacrifice fighting fascism. Now people are kind of lining up to support it, and also kind of lining up to kill their fellow humans, apparently, and lining up behind the brain worm. It's really
Yeah.
sad.
You mentioned the the board organization of OBGYN
Yeah.
doctors and the vulnerability of pregnant women with COVID, but you could pretty much focus on, you could mention any group of doctors, that the American Pediatrics Association or whatever it's called. They keep having to put out statements to the federal government to say, listen, this is what we do all day, and what you're saying is wrong, and people will die. Do I have that about right? That like all the doctors and they're not all on the take. Are you on the take, Rob?
No take. Never got a penny from pharma. I think I got a lunch from pharma a couple times in residency. I got some pad thai during a tox conference. Like full disclosure, I did. Pfizer rep handed out pad thai every Thursday, once a month. So that's about it. That was a long time ago. Hopefully that pad thai is worn off by now. But yeah, it's truly I don't know. I guess like RFK, Trump, their whole crowd, maybe they don't understand people that actually try to do their job, for their own fulfillment. I mean, I feel fulfilled by being a doc. I like what I do. I like that I get to kind of use my brain in a certain way, use my training. But a lot of what we all signed up for is to help other people. That I think is a foreign concept to certainly Trump, RFK Jr., folks in his cabinet, folks, in his wider circle. And unfortunately, as evidenced by, a lot of the very selfish rhetoric you hear about, COVID, well, fuck it, I don't care if I don't get sick, who cares about other people? A growing number of the people who support him kind of had that same attitude.
There's a lot. It seems like the headlines coming out of HHS and all, we're all learning the agencies that HHS oversees as well, because they're spinning off and out of control or being run by cartoon villains. And, staying with the vaccine thing and the pediatricians, there's every year that they come out with a schedule, which gives guidance to pediatricians on to when and what vaccinations. And it is really well researched and referenced and not very controversial, I don't think. But they also changed that. I mean, just sticking to the issue of, they also, what was the headline about mRNA and pulling support and funding for this miracle breakthrough in research that not only treats COVID, but some very serious, nasty other diseases and so on. So just talk a little bit more about the vaccines that have either been changed, withdrawn, or had their research ended or whatever.
Yeah, I mean, when they change the schedule, when they do it without evidence, right? Like we have changed the schedule. We've changed a lot of parts of healthcare. We used to give aspirin to all people over a certain age with risk factors or heart disease. You don't do that anymore. You do it on someone who's had a heart attack or has heart disease, because we know taking an aspirin does have a negative effect on some people who just don't need it. So we're all willing to change and happy to change when we get more evidence. A lot of what I learned 20, 30 years ago is different now than it was then. We have to keep up with that as doctors, and certainly those agencies keep up with that data. They meet on a regular basis, and they comb the data. They look at all the the effects of these drugs, both negative and positive, and they come up with the schedules. But when those schedules are changed for political purposes, that's part of why the CDC director wrote a letter about that. I think 4 people at the CDC, the director was fired, but 4 other higher up people, the CMO, like the head of vaccine and respiratory illnesses, a couple other folks resigned. And some of the things they cited were the changing of the schedule without evidence, right? Politically motivated changes. mRNA is really particularly gross, because this president, like, he should have run for that and potentially won re-election in 2020 based on Operation Warp Speed. Like, literally a sane person in a sane society would have had every hat, every sign saying Operation Warp Speed, vote for Trump. And I think that would have been enough. Like, that effort. And did Trump do that? No, he didn't. But he was the president, right? He gets to claim credit. When they lose jobs and they're president, you give them the blame. When they pick up jobs, you give them the credit. They did Operation Warp Speed. He was the president. He gets to tout that and pound his chest. He didn't do that. Like, that's insane. And now the platform, the mRNA platform that's been around for over a decade before COVID, that allowed us to have that rapid response, they're pulling research on that and limiting that. I mean, that whole platform, they had treatments and trials treating brain cancer. I mean, I had a good friend who died at 43 of a horrible brain tumor, glioblastoma. We've all probably heard stories of that, young people in the prime of their lives dying of these horrible diseases. And here's a treatment that potentially could save these young, healthy people with brain tumors. And because RFK Jr. has the worm in his brain, we don't get to do that anymore. We don't get to play with that tool. It's cruel. I mean, we got to keep talking about it. Like the MAGA crowd's not going to hear it, the Maha crowd. And then there's a lot of folks who, it's preaching to the choir, but there's a lot of sort of normies out there just living their lives, and they don't know what's right. Right. They're just living, and they see some headlines. And
people, I don't know if you know this, a lot of people do their own research.
Oh, there you go. I have a tombstone we put out at Halloween with a little skeleton in your yard. It says, I did my own research 2021. So, well, yeah, I've heard that one too much.
Yesterday, I think it was yesterday, a couple days ago, RFK went on in front of cameras, and he said that he sees kids walking through the airport and other places where he goes. I'm paraphrasing a little bit, But he said he can tell when a child is dealing with, quote, mitochondrial challenges or, quote, inflammation by just looking at them. How egregious and dangerous is that? You're an ER doctor, and can you look at a child? And what does that even mean? Mitochondrial challenges of a child. I mean, do you diagnose? I suppose you can. It matters the way they. Well, he's not a doctor, and he's saying these things.
Yeah.
Please help.
Yeah. Well, he says people shouldn't take medical advice from me. He said that in a hearing after he was it was after he was nominated, and we all said yes, we agree. Stop giving out medical advice, right? Why is this creep looking at all these kids in the airports? That is a little creepy, right? B, maybe they're not looking at you because you scare them, right? I mean, this old dude's like checking me out, like sir, they don't want to do that. C, I think I'm on the letter scale. What is he talking about, right? This is insanity to look at people and diagnose some complex metabolic syndrome derangement that they sort of. It's almost like the turbo cancer kind of term that was coined to describe something that doesn't exist. Cancer from the COVID vaccine. Some folks brought it up. He heard it, and he'll keep repeating it. So the same with this mitochondrial mess that supposedly he can diagnose walking by. I mean, we were trained, and this is the thing. I train residents even. When you go look at a kid who comes in, their parents are worried they're sick. Your first thing is sick, not sick, right? Like some kids, they got sniffles, they got crud, they're okay. They're going to be fine. And some kids, they're just sick. They're sick, and then you got to figure out why and figure out what to do for them. He was not trained in that. He doesn't know that. He's not a doc. He shouldn't know that, and he shouldn't talk about it and try to scare people with whatever he's calling this science. And he does that. He throws around big words that make it sound like he's somehow in the know, and somehow the deep state is hiding things from these parents. And really, it's him just making shit up.
Or he's not even making it up. He hears it from somebody else. I think sometimes we give him too much credit. He's also like raised alarm about childhood diabetes, which is a huge thing actually. But he's used incorrect statistics on autism. He says he's going to find the cause, and I know the autism community of families is not monolithic. But I have seen and heard that a lot of families that have kids, especially that have autism, are pissed because it insinuates that they did something wrong, that they caused the autism that their kids are dealing with. And I've heard from these parents. And how dangerous is it to kind of raise and also then not raise concerns today or yesterday on TV about the leading cause of death of children, apparently guns. So he thinks we need to look into mental health issues, not the guns. And one side, he's denying the actual problem. This happens about a lot of things in America, just ignoring the real problems and then creating problems where they don't exist.
Right. Yeah, I mean, again, in light of the horrific shooting in Minneapolis, it's particularly gross that he would completely ignore that and then talk about something. I mean, your statement about families with folks with kids with autism and kind of being pissed. They should be pissed. They should be pissed about that. They should be pissed about him characterizing people with autism as folks who will never love, who can't wipe themselves. Do you remember that little diatribe he went off on? Mischaracterizing folks on the autism spectrum, sort of classifying every person who's severely autistic and extremely, far in the spectrum with folks who are highly functional, capable of love, capable of complex jobs and complex equations, and certainly, capable of wiping themselves. So that's another piece. But then the other piece that's I think the most insidious, which he's capitalized on, is so many families with their child with autism are looking at this previously healthy appearing child, seeing them like really struggling and suffering, how that impacts the individual, the families all around. And he is giving them false hope that he, A, will find the reason, B, that he many times has touted he has found the reason, right? And it be vaccines in his mind. And so when he can point to that, tell them this is the cause. If you're a desperate parent, desperate family, looking for reasons, looking for answers, and someone tells you it's this, I cannot blame people for jumping on that bandwagon and going along with a supposed person in power and expert, So really him preying on those very vulnerable and susceptible families is particularly gross and insidious. I mean, he should be rejected from civil society for all three. But instead he's at the top of the heap in this administration.
What else do you want to say about,
Mm,
gun violence in general, and not particularly, 60% of gun violence deaths is suicide, and there's a lot you
yeah.
can do to prevent that. Just make it harder to get a gun when you're feeling at your lowest. For example, there's all kinds of regulations and so on. But what else do you want to say about gun violence and the way that this administration and this HHS or whoever else is handling it, looking at it?
Yeah, I mean, one particularly egregious thing I saw, I think Representative Andy Ogles posted, thoughts and prayers, and someone, and I think they subtweeted a picture of he and his family with AR-15s, and the fact that so many people have access to weapons of war, to guns that can fire so many rounds in such a short period of time. I mean, it's bad enough if you have a handgun firing off a few rounds, but the amount of destruction you can do in some of these mass shootings, number of people you can kill or injure so quickly, so easily. The loopholes against background checks that would be easy to close, right, with legislation. The shield laws protecting gun manufacturers from any liability when their weapons of war are used to kill innocent people. Um, it's there's not enough you can say about it. I mean, we've been talking about this forever, it seems. I remember back in 2018, the March for Life after Parkland. I think a month after Parkland that happened. Maybe it was an anniversary of Parkland, if I'm not remembering the dates. But I feel like we've been kind of beating this drum for so long, and their response is always the same thing. Right? It's not guns, it's the people. Well, we're the only civilized society, only Western industrialized society, maybe only society anywhere that has this problem, right? And so maybe it maybe just maybe it is in part the guns, and maybe we need to actually have some legislation to just kind of control folk, who gets it and what kinds they can get and how much damage it could potentially do. And I'm sure a lot of people would be pissed off hearing that, but it's just the reality that we're dealing with. And as docs, and I work in a small rural area. We haven't seen anything like this. Thank God. I'll knock on wood. But these mass shootings, they can happen. They have happened anywhere, right? This isn't confined to big cities and blue cities and all these places. This just sort of randomly can happen anywhere. So people should be concerned. My kids are all out of public school now, but I very much every time something like this happened, you think about your kid and doing the drills and
Yeah.
you know
Yeah,
something needs to be done.
I was with my daughter yesterday on a college visit, and I was purposely plugged out of the news, but of course we sat down for lunch, and I stupidly looked at my phone, saw about the shooting,
Mm,
and I brought it up to her, and she had a very, it's not like I didn't know this, but it said a really honest and awful conversation about it, where she talked about how scared she was in just being in school, and I was just like, it's so hard just to be in that building for a lot of young people, period. Having to worry about
right,
that is so awful. And yet, we haven't done enough at the federal level, at the state level, and a lot of activists, we need to give credit for them. So I always hate when people say nothing changes, because things do change at the
right,
state level. And a lot of activists
right.
are working hard to elect policy makers who will do something, and they have. Rob, this CDC, you mentioned it. Trump fired the head of his CDC, who he picked. The excuse, my understanding, is that she wasn't loyal; she was
Yeah,
disloyal. Um,
right.
and it's a crazy thing. The word loyal is a weird, I don't like loyalty
No,
to a
no.
politician, or I don't even like, it's earned and it can be broken. And what do you make of that? Apparently they announced a new head of the CDC today. You mentioned those other three physicians and scientists that also resigned. There was a walkout today in Atlanta at the CDC. This is such a huge, important deal. People don't understand how great. Most people heard of the CDC only through COVID, and it gave them a black eye because they got some things slightly wrong. But it's
Right.
like, we also know it's the gold standard for the rest of the world. So what more can you say about what's happening in that very, very important institution?
Yeah, the thing about public health and the CDC being the kind of tip of the spear of our public health response in this country is public health. When it works, you have no idea it worked, right? You can't have a bumper sticker that said, "Look at us, we prevented disease," right? Because it didn't happen and it doesn't register, and it shouldn't. And people who work there, who have worked there, gladly do their jobs knowing that, right? They're not going to get any glory. I remember at my med school graduation, the person who spoke looked at a bunch of us out in the audience. I was going to the ER, other people into surgery, other specialties, said, "All you people who are going to lay hands on patients, that's great. You will impact people's lives." But boy, the people who make the vaccines, the people who study the diseases, those people will save, orders of magnitude more lives in their careers. And it is true. Uh, we just don't know it's happening when it's working, and that's a good thing. I fear we will know what's happening when it isn't working, and that's what we're staring down the barrel at. Is it not working when they put people who are loyal to a person or to an ideology rather than people who are loyal to data and science? And all the do my own research people are going to spout off about that as, oh, the science data corrupted, blah 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 blah. Bullshit. These people
Yeah,
are career people who are trying to help people. Sometimes they get it wrong because it's fallible. People are fallible, but they're not nefarious like Trump and RFK and those folks. That's who they're putting in there.
yeah. You mentioned the vaccine makers. I'm good friends with Peter Hotez, and so I've known
Yeah.
what he's dealt with personally
Mm.
in his career. Man has saved millions of lives with the vaccines that he's helped produce in third world, underdeveloped countries, and a frighteningly large portion of America. Is calling him a murderer. And by the way, this is what fucking pisses me off. Hotez was on Joe Rogan. He was on the show
Yeah.
and I was on Joe Rogan. And so like we both know the guy, and Peter told me he texted Joe and said, "What are you doing? And, have me back on, have me on with somebody else." And he just ignored it. I mean, guys like that are so responsible for
Yeah.
the misinformation and conspiracy theories, and they know better. He knows him.
Right.
He has his number. He knows better. This guy saves so many lives, and he gets demonized. I'm sure you do as well, just for the things that you're saying, much less the lives that you're saving every day in the ER.
I do, right? I mean, I've had, some fire come my way, certainly not like Dr. Hotez. He's done it on a much bigger scale and taken a lot more arrows. But I think those of us who choose to speak out, speak on the side of kind of truth and reality, and always in the interest of kind of helping our fellow human and the most people we can possible, I think you just have to make that choice, right? I think these folks at the CDC who left made that choice, right? They had to leave because they couldn't, be loyal to this ruthless attack on reality that's going on in the administration and at HHS under RFK. And so, they had to leave a job, I would imagine, a career that they found very fulfilling, I would assume. I think getting to that level in that public health apparatus, I think the significant impact you're having on lives of people, and giving that up has to be painful. So if any of those folks are listening and want to, come and talk, certainly talk with you, talk with us on Paging America, join up with the Committee to Protect Healthcare. We're working on right now a campaign responding to these firings and the FDA decision to have doctors call on their members of Congress to do some investigations. In a normal functioning government, if 5 very highly placed CDC level director people either quit or were fired in the span of a day, Congress would be investigating what happened.
Yeah.
Just asking what happened, how'd that happen, and what are the ramifications. We don't see any evidence of that happening thus far. I think we need to pressure those folks to do that.
I'm looking at your podcast, Page in America, which everybody should go subscribe to and listen, as well as a Substack and support Committee to Protect Healthcare. You have an episode, your most recent episode is "It's Not the Bruise, It's the Cover-Up." Have you weighed in on
Yeah.
the bruise on Trump's hand?
We had the reporter from the Daily Beast on who kind of broke that story about the cover up on the hand. And so, yeah, that was, I haven't weighed in. Listen, I think there are still a lot of questions. And that was what the kind of the gist of the interview was, that there's so much secrecy and defensiveness going on in the administration about his health that it just makes people question what could be going on. I've said it all along. They said it's because he takes aspirin and shakes hands. So A, who shakes hand with the back of their hand? B, why is he taking aspirin? They told us he doesn't have heart disease, that he's never had a stroke. Those are the people who should be on aspirin, not just a random nearly 80-year-old. So is there a reason, right? Does that connect to the fact that he clearly has swelling in his ankles? They said it's venous insufficiency. Maybe it is, right? Elderly gentlemen who are a bit overweight will definitely have veins that don't drain well, and they'll get swelling in their legs. Could be as simple as that. But until they're forthcoming, I think their response was a letter from Ronnie Jackson. You know Ronnie Jackson? Ronnie is a former ER doc, congressman, former White House physician, was dealing in drugs while he was at the White House, drinks a bit much, would seem at times, and just speaking in hyperbole, telling us it's the healthiest president in the history of the United States. I mean, come on. I mean, we can see that that isn't true. We don't have to ponder real diagnoses just to know, that that is demonstrably not true. So just share the information. Like, the American people have a right to know if there's something going on with this guy or not. Alex Jones apparently really wants to know. He thinks he's on death's doorstep. So I think we all deserve to know.
You're so good at talking about all these things. Everybody should listen to the podcast and listen and follow Dr. Rob Davidson. I really appreciate your passion, and I know it must be so hard knowing what you know and doing what you do to see what's happening. The fact that you haven't turned away and haven't become so cynical, we all have a certain thick skin, that you're giving up matters. Obviously, it matters that you practice and that you're still doing the work that you do. But the way that you talk about it is important, and sadly, it's increasingly courageous. So I appreciate everything that you're doing with the podcast and the nonprofit, and I always appreciate when you come talk to me. So, anything else, Rob, that I didn't ask you that you wanted to weigh in on?
I don't think so, but like right back at you. You're providing a platform and you're speaking out against what we see going on these issues with healthcare, on other issues with the administration and autocracy and everything they're doing. And I think it's important that there are as many voices as possible, because people consume information in so many different places. We need to make sure people are seeing and hearing what's going on and what's wrong with what's going on, right? If we all become silent, that lets them do whatever the hell they want to do, and that's not going to fly. Not at least while you and I are on the watch.
Next episode, Peter Attia, right or wrong? This guy's got have you heard of that guy?
No, maybe.
That's crazy to me. It's crazy because my close friend, Dr. Aaron Carroll, who's a researcher and media guy and doctor, he too hadn't heard of him. Peter Attia and Andrew Huberman are massive. Rob, I want you to go live and tell me, like, a lot of what they say seems, science-based, and they ride a fine line. I don't know. Know. They're all about like health and longevity and protein and
yeah.
I don't know.
Next episode. That'll be my intro.
Yeah. I want to see what you think. So,
all right, I'll report back.
All right, man. Thank you very much, Rob. I appreciate you.
Yeah.
All right. I'm going to kick Rob out, but leave him there and say bye if he's still there. Just want to let everybody know that watch live. Thank you very, very much for joining us live. And I will talk to you tomorrow right here. And that's it. I'm going to hit end. Bye-bye. Thank you, everybody.